If you failed the military MEPS medical exam, you are not alone, my friends. MEPS be killing people's hopes and dreams left and right like it ain't nobody's business. But in this video, I hope to improve your military medical waiver request approval odds by up to 90% by supplying you just a few simple tips, tricks, and insights. Did you know that 34% of the applicants processing MEPS with the hopes to pass their medical exam are rejected for enlistment, leaving their basically their status open or inconclusive, either requiring more medical documentation or a medical consultation with a specialist and or a medical waiver. I value and respect your time, so I research the hell out of my videos so that I can be as clear and concise as possible so I can get straight to the point with no fluff. I pride myself in being the most accurate and up-to-date military army YouTuber to date. I encourage you to watch the entire video, for this topic is complex and I refuse to address any one of your questions in the comment section if I've taken the time to address them in this video. So respect. Just saying. I've also placed down here some chapters for you to bounce around the video if need be, but it is in your best interest to go from end to end and watch the entire video. Thank you for your patience, and may the MEPS gods forever be in your favor. Disclaimer: medical waiver results may vary depending on your unique circumstances, detailed medical history, and medical supporting evidence or lack thereof. The responsibility of retrieving medical supporting documentation is and always will be on the potential applicant. At this point, you are disqualified and ineligible for enlistment. You must now prepare yourself for an exception to our medical pre-accession medical procurement standards. If and only if approved will you be allowed to enlist or contract, and don't be surprised if you are restricted to certain job skills on your medical profile. Firstly, let's identify or define what a medical profile is. A medical profile looks like this within the system, and we refer to it as PULHES. PULHES is an acronym for the physical or medical exam. P is for capacity or stamina. U is for upper extremities. L is for lower extremities. H is for hearing and ears. E is for eyes. S is for psychiatric. PULHES includes rating numbers from 1 through 4. So to be brief, 1 and 2 means a soldier is deployable. 3 and 4 means that the soldier cannot deploy, meaning that they are non-deployable, unless a waiver is authorized. So in other words, to pass a MEPS medical exam with no restrictions, limitations, or disqualifications, you must score a 1 in each one of these categories throughout the PULHES to be able to be in a position to be able to assign a contract. So in the recruiting world, we call this a picket fence. However, if you are rated 2 through 4 on your medical PULHES, you are going to be disqualified, and that means that you're going to require a consultation, a medical waiver, or denied altogether. Understand that MEPS does not approve or disapprove medical waivers. They can only determine if you're qualified or not qualified. Then it is up to your branch of service to approve or disapprove or return without action on your medical waiver request. And food for thought, if your branch of service that you're attempting to join denies your medical request, you might want to go check out another branch of service, because they might, just may, approve your medical waiver. So you never know. Do with that information what you will. So let's say you fail multiple parts of your medical exam. It would fall under one medical waiver. For example, let's say they get you for astigmatism, E for eyes. Maybe you fail your hearing test, which is H for your hearing, and then lower extremities because you had a knee surgery, ACL knee surgery when you were in the 12th grade and you're now 30 years old or something along those lines. That would all be encompassed into one medical waiver. Now with this explained and hopefully understood, let's get into the meat and potatoes of this waiver process and best practices. It means that you were found medically unfit for service. So in layman's terms, what that means is you are ineligible to join, you are disqualified, but we're going to request permission based on your medical history or pre-existing condition. You are authorized to join. That's essentially what it is. Permission. Additionally, medical waivers can be combined with other waivers like moral waivers, administrative waivers, age waivers, tattoo waivers, so on and so forth. Things that will be considered by the final approval authority are things like your AFQT score from your Adhd test, your highest level of education completed, your employment history, your criminal history, height and weight, your character references, physical fitness level and history. All these types of things are going to be factored into the decision-making process and whether or not they will approve your medical waiver. Note that if you make a claim and there is no supporting documentation to back it up, it will not be considered for your waiver request. For example, let's say in your applicant statement that you spend 5 hours a week, 5 different days with a personal trainer. Unless you have a written statement from your personal trainer verifying the validity that they in fact are training you 5 hours a week at 5 days a week and blah, 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 it won't be considered. Just, food for thought. For the sake of brevity, there is a plethora of reasons that you could be disqualified before or even during your MEPS medical exam. Now, I'm not gonna go over every little thing that could possibly go wrong during a medical exam because I would be here all night. But with that being said, I am gonna share with you some general guidance that if it fits your unique scenario, that these tips and tricks can be applied, and this is general advice across the board. So some of the most common disqualifications at MEPS are, but not limited to, ADD, ADHD, anxiety, depression, self-harm, asthma, surgeries, and way more. But those are some of the main ones that I will be touching within this video. So depending on your pre-existing medical history or conditions, you will need all of the following if it applies. Emergency room records, not the discharge document, but the actual emergency room records. Doctor visits, any follow-up doctor visits, both pre and post surgical records to include the operative report, the progress notes, and any relating pharmacy records. And you will need a primary care physician or specialist all clear letter or memorandum. So with MHS Genesis in play, it is a hit or a miss on whether or not MEPS is gonna have full access, partial access, or no access to your electronic medical records. So whether you self-admit or you try to sneak it in there and not mention anything, you sneaky little fella, just assume that MEPS is gonna be able to see it. If you don't know what MHS Genesis, you don't know what I'm talking about, I will link a couple of videos that I did explaining it down in the description area for you to check out. The good rule of thumb is be proactive rather than reactive when sourcing your medical records for processing, all right? In theory, MHS Genesis is supposed to have access to any and all of your electronic medical records, hoping to eliminate the need to source those medical records on your own, but unfortunately, they don't always see it. So with that being said, do your due diligence, be proactive, go out of your way now so that you don't delay your process, making this whole annoying process even longer. Go and source all of your supporting medical records pertaining to your potential disqualifications prior to submit with your complex pre-screen before you even get scheduled for MEPS, all right? That way, if Genesis doesn't see all of the records, you have them. This tip is more beneficial if you have had the same primary care provider the entire time since the incident in question, but nonetheless still can be applied with your current provider. Since the pre-existing history or condition that has brought us to this moment, if you've been signs and symptom free since that incident till now, you need to obtain an all clear letter that since this date of incident till now, you've been signs and symptom free. That letter is extremely important and going to be critical to your approval odds for your medical waiver, but more to follow. So now that you've sourced your medical records, you got an all clear letter from your primary care physician, now I need you to go get updated tests and evaluations, especially if it's been more than 6 months, a year, or even longer, right? You need something within the last 6 months. So any and every test or evaluation you possibly can get, you need that to prove and validate that you are in fact clear of this pre-existing medical condition or issue. Whatever your disqualification is, do yourself a favor, especially if you have insurance and you can get that referral, if at all possible, try to get a referral to go to the highest specialist you possibly can to get that consultation done so that you can get those tests and evaluations done by that expert in that field. For example, let's say you have an issue with your spine, go to a spine surgeon. Or let's say you had an ACL knee surgery, instead of going to a regular orthopedic, go to a sports orthopedic, you know what I'm saying? So do the best that you can to get to the highest, most reputable expert in that field to get their medical professional opinion. Otherwise, you're gonna be at the mercy of the MEPS to schedule you for their civilian contracted medical specialist to conduct your medical consultation. Now, keep in mind that your recruiter is gonna have zero impact on when they schedule you for this MEPS consultation. So with that said, that consultation, that medical consultation that's gonna be scheduled to a civilian contracted medical professional could happen within a few days or upwards to 8 freaking weeks. And sometimes it's happened to me. It's happened to me, literally me finding out at like 7 p.m. the night prior to the appointment. I'd be like, yo man, I gotta pick you up and take you to this medical consultation. So it doesn't matter if you're in college, high school, work, what have you, if they schedule you for this consult, you need to be ready for it. So the reason why I keep telling you to go with a specialist or the highest specialist as you possibly can, because their medical professional opinion is always going to supersede and trump a general medical practitioner. Hopefully that makes sense. So the intent of doing all this, meeting up with the specialist to get these updated evaluations and tests, is to mitigate and to eliminate any possible doubt that the MEP CMO or the Surgeon General who ultimately reviews your waiver when processing for a medical waiver will help put them at ease that you are medically fit and sound for duty, military duty for that, and getting these all clear letters is going to significantly improve your probability of getting your waiver approved. So what exactly does this letter need to say? And say less, fam. I got you. All right, pay attention now. This is this is it, all right? This is the most important task that needs to get done. Now that you've gotten everything all done, your all clear letter from your specialist needs to include like a summary of everything that transpired, to include their medical professional opinion, which I'll cover in a second, your original diagnosis, your current diagnosis or assessment, include by name the different tests and evaluations that were conducted to include the results of everything all together. The letter needs to say something along the lines that based on these tests and evaluations, patient X is otherwise a healthy human being. Based on those results, that there is no reason that they cannot complete military physical activities to include but not limited to the following: crawling, kneeling, crouching, walking, jogging, sprinting, jumping, climbing, lifting, pushing, pulling, or throwing, even under a heavy load, with no limitations or restrictions. So depending on your pre-existing condition or issue in question, obviously, there's no guarantees that that will no longer be an issue, but depending on your disqualification, the MEP CMO or the Surgeon General is going to be looking for a statement from your medical professional to say something along the lines like, guarantee me that this ABC condition is never coming back again. Now, for legal reasons and not being putting in a position where they could possibly get sued in the event that that pre-existing issue or condition comes back, they're not going to be comfortable with saying that. So what I suggest is that you have them claim or state that based on their professional medical assessment and results of the test, that you are otherwise a healthy human being, and as long as you live a healthy and active lifestyle, the likelihood of ABC condition will not come back or anything like that. Hopefully that makes sense. Something along those lines. Now, I know that this is a lot, but by not doing all of this is going to significantly decrease your odds of your waiver getting approved. So hang in there strong, take the extra mile, because it will improve your odds in getting your waiver approved. I promise you, you will get a better, more favorable outcome if you do all this. Side note, bonus tip, what have you, right? Let's say you had a torn ACL knee surgery from the past. MEPS is going to see you as being at a medical disadvantage and potentially at risk of re-injury in the future doing military tasks during either initial entry training or future deployments or what have you. So we need to mitigate these opinions of your medical condition from your past. So it's in your best interest to come up with a physical activity report. In that physical activity report, you need to annotate how many days a week do you work out, how long are your training sessions, what type of training are you doing? Are you lifting weights? Are you knocking out high intensity interval training, cardio? And if you are lifting weights, typically how much weight are you lifting? Like, are you benching 225 or more? Are you deadlifting 340 or more pounds and all that good stuff, right? How intense are your workouts, right? And how long have you been training for? 6 months, so on and so forth. And don't be afraid to list any type of events that you've completed previously, like a half marathon, full marathon. Let's say you did a Spartan obstacle race or something like that, right? You need to show them that you are physically capable of doing physical activities as we described in those letters, right? It would also be in your best interest to knock out an occupational physical assessment test known as the OPAT, or the Army Combat Fitness Test known as the ACFT, right? Try to score up to a heavy on these tests, right? We want to show them that you are physically fit, you are sound, and you are not at risk of re-injury or whatever your medical condition is. You are able to fully and capable of knocking out military physical activities with no limitations or restrictions. With this said and done, this is going to paint a nice, pretty picture that you are physically sound and capable of completing military training and be deployable. Because if you're not deployable, you are not going to be considered for enlistment. Or if you're perceived to be a VA, potentially a VA disability claim in the future, we don't want you, fam. We're good. In this section, I'm gonna be talking to you about ADD, ADHD, and anxiety. Now, it is in your best interest to be signs and symptom free and stable with no medication for at least 36 months. But MEPS will entertain you on a case-by-case basis. You will need to source all of your pharmacy records pertaining to this medical issue. Both the MEPS CMO and the Surgeon General does not care that you were prescribed ABC medication and never used it, or picked it up and never used it, or never picked up your refills, or what have you, all right? They're looking at the refills, the dosage, how often you had to consume your prescription, and how long overall have you been on this medication. Furthermore, because I've actually heard this excuse before, right? Or their reason, as they say, that their parents used them to obtain their prescription for their own personal use, or whatever other excuse or reason that you have, unfortunately. Whether you were formally cleared or not from your past of ADD, ADHD, or anxiety, you need to get updated evaluations and testing, so go see a behavioral health specialist. So if this applies, have them state in an updated memorandum or letter that you're all clear and that you've been off of medication since ABC dates, and that you're not dependent on these medications, and that you are stable. Since your treatment for ADD, ADHD, or anxiety has ended or concluded, that you have been signs and symptom free, and that you are stable with no limitations or restrictions, and that you have experienced 0 adverse reactions, and that you are not dependent on your medication. Another critical step in this entire process is to obtain character reference letters. So if you're working, you need to get a letter from like your employer, other colleagues that you work with, other students, teachers, professors, pastors, or other organizations that you work closely with, right? You need that letter to be able to state that you are performing and acting like a normal functioning employee, student, or what have you. And it helps to add that you haven't had any limitations or restrictions, and that you're trustworthy, and that you are a good performing person, if that makes sense. Something along those lines. You must be off of your medication for at least 6 to 12 months and remain and continue to be in a stable condition without having any history of a adverse reaction of being removed from your medication. So depending on your level of history of depression or severity of your depression will dictate whether you need a minimum of 3 months or 6 months or more of updated mental health evaluation. So when you go to submit a medical waiver for depression, you're gonna need a mental health evaluation within the last 6 months of you submitting for this medical waiver. So if you had something minor, like your boyfriend or girlfriend broke it off with you, or maybe you went through a divorce and you did not express any type of suicide, or it wasn't that big of a deal, then maybe 3 months of mental health counseling once or twice a month would be suffice. But if you had something like pretty extravagant, pretty life dramatic, like PTSD, borderline type stuff, and let's say you had ideation, or you expressed suicide, or maybe even attempt suicide or something along those lines, right? Then you're gonna need 6 to 12 months worth of mental health counseling once or twice a month to satisfy the Surgeon General, to make sure that you are mentally fit and sound and solid and stable to be able to join the military. Because you have to understand that being in the military is a high stress environment, especially if you get deployed overseas in a combat scenario or certain scenarios such as that. So you need an updated mental health evaluation to make sure that you are good to go. And as always, obtain your pharmacy records pertaining to your depression. And as with any pre-existing medical condition or issue, make sure that you source all your mental health records, okay? If you went to the emergency room, you went to the psych ward, you went through mental health or psychiatry or any other type of mental health counseling, you're gonna need all those notes for each and every single session that you ever went through that's dealing with your mental health, to include your updated stuff. So you're again gonna need that original diagnosis, right? You need all those notes and obtain an all clear letter from your mental health professional that you're about to submit. So now that you've completed your new mental health evaluation, you need an all clear letter, and that needs to say something but not limited to that you're all clear, you're no threat to harm yourself or others, that you're mentally sound, strong, and can handle a high stress environment like being fully immersed into a military environment with no limitations or restrictions. Additionally, you're gonna have to have a super strong and solid applicant statement, which should include the following but not limited to the why and the reason for your depression in the first place. What stopped your depression? What made you feel like you've become better or no longer depressed? What support system do you have in place now and do you have in place now to prevent you from falling back into a depressed state of mind? What coping mechanisms do you have to fall back on and to continue to use to prevent you from going back into that depressed state of mind? Note, all right? Do not pat or downplay your depression, all right? What they don't want to read or see in your applicant statement is, oh, I was just silly, I was young and dumb, it wasn't a big deal. They want you to own it, and they want you to be 100% honest, because if you want them to take the risk of bringing you into this great organization, then you need to be upfront with them, because if you can't even own up to it and you can't be honest with yourself, then we don't need you, because you're just gonna be a risk to yourself and possibly others. And again, the last thing we wanna do is to put you into a suicidal situation where you wanna take your own life because of it. Note of a recent update. So, for suicide ideation is not a disqualification any longer after 12 months if no plan, gesture, or attempt is made since the last incident. Now, there's no further guidance that I received that if you've had like multiple incidences of like suicide ideations or worse, how that may or may not impact your waiver outcome. But when it comes to suicide, it is a very, very touchy subject. So you never know unless you try, all right? So just go through the waiver process. Hopefully your recruiter has the ability and the desire to at least do the paperwork and submit it and throw that Hail Mary like a wet noodle up against the wall to see if it does. If it sticks, perfect. And if it doesn't, at least you try. Additional note, but I'm gonna read this off of the teleprompter because I keep jacking it up. Any prescription for psychotropic medication within the last 36 months, unless in another standard such as ADHD, this includes but not limited to antidepressants, anti-anxiety, stimulants, antipsychotics, and mood stabilizers. Nailed it. All right, so this will either come up in Genesis if it was documented, whether you went to the emergency room, a school nurse, a medical facility, something like that, that's participating in Genesis, it will be visible and MEPS will see it. The other way MEPS staff will find it is during your medical exam. And obviously, if you're watching this, it's because they did find it in Genesis or physically on your body. So in your applicant statement and your records need to state this. As with any other medical pre-existing issue or whatever, make sure that you get all your records, your emergency records, if you went to the psych ward, those records, if you did mental health counseling, those records, right? Any hospital visits or doctor visits pertaining to your self-harm and when it was documented, if it applies. In this too, you will need an applicant statement, a strong applicant statement with you being 1000% honest, all right? Be up straight and forthright with this, okay? What was your real reason, your real life reason for harming yourself, self-harming yourself? Why did you stop your self-harm? What makes you feel like you are better? What support system do you have now in place to help prevent you from relapsing and going back to inflicting self-harm? And what coping mechanisms do you now have or continue to have that's going to prevent you from conducting self-harm? And again, as previously described earlier in the video, do not pat or downplay your self-harm, okay? Own it, like completely and utterly own it. You messed up, whatever. Do not say it was no big deal. I was young and dumb. I was stupid. I don't know what I was thinking. It's not a big deal, all right? I was just being silly, all right? Just don't say those types of things in the letter because you are guaranteed to get a... Being diagnosed for childhood asthma is not going to permanently disqualify you, meaning that you're not going to get approved for a waiver. This is a very, very simple waiver as long as you meet this criteria. So with that being said, the first thing you want to do is source all your medical records from the emergency room, hospital visit, doctor visits, anytime that you officially expressed asthma-related signs or symptoms and you sought medical attention through a medical professional. You're gonna need your pharmacy records to show all the different inhalers that you were prescribed, even if it was for precautionary measures after age 13. So the rule of thumb is, if you were born and diagnosed with childhood asthma and from age 13 years old forward to current age now, you have had 0 issues with asthma-related incidences, meaning you've never been in the emergency room, a doctor visit, or a hospital for asthma-related breathing issues, despite you being prescribed for precautionary measures, an inhaler or a pump. That is perfectly fine. You're gonna get a waiver and is going to get approved. In rare occasions where, let's say you had been born with childhood asthma, but you had an asthma attack at like 14, 15, maybe even 16 years old, maybe even 18 years old. And let's say you're over 25, 28 years old and you've, for over 10 years, haven't had an asthma-related incident, and you're like doing CrossFit, you're doing mixed martial arts, you're doing a lot of cardio, maybe even you're running like marathons and so on and so forth, you're still gonna be poised in a good position to get a favorable outcome for an asthma waiver, all right? So source your records, get an updated PFT. This is gonna be required. A pulmonary function test with negative results. All of this will help you get a medical waiver. And as previously described, you're gonna have to get an all clear letter from your primary care physician, okay? In that letter is gonna have to state that yes, you were born with or diagnosed with childhood induced asthma, but from age 13 forward that you've, again, never been to the hospital or sought medical attention for asthma-related incidences, and that your inhaler that was being prescribed to you over the years is as a precautionary measure only, and you'll be good to go. So this is gonna be dependent on how fast we can get all of your records pushed through the chain of command to get to the final approval authority, which in this case would be the Surgeon General, and they're going to process it in the order that it was received. Now, for the Surgeon General to review it, depending on the complexity and how in-depth your medical condition or history is and how much supporting medical documentation was submitted, it could be completed within a few days or upwards to several months. So if you're having a very in-depth, complicated case, it's gonna take longer for the Surgeon General to review everything to make a decision on your medical waiver. So no news is good news. So best case scenario, it'll come back within a few days to a couple weeks. The average is 30 to 90 days, with worst case scenario up to 6 months. And with that said, good luck, be blessed, and may the waiver gods forever be in your favor. Team Swartz, signing out.
These neck just wanna be a mini me. All these neck just wanna be a mini me. All these neck just wanna be a mini me. Friend of me, any me. All these neck just wanna be a